All right, it is 7 p.m. We are still seeing quite a few people hopping on here in the last 2 minutes. So I'm going to give them just one more minute. Just another reminder, good evening, everyone. Glad you are here with us tonight for our exciting Wednesday Wellness Pediatric Edition, COVID-19 vaccine in children, what every parent wants to know. We will begin here in just a moment. As a few reminders, your cameras are automatically off and your mics are muted. This is intentional. It is due to the high number of participants registered for tonight's event, and it will allow our physicians to deliver a smooth presentation and assure all of the information does get shared. We do have time saved at the end of tonight's presentation for questions. If you have questions throughout the event that come to mind, please type them into the Q&A section at the bottom of your screen, and we will work through those with our providers following tonight's presentation to get answers out there for you. Our recording of tonight's event, along with the presentation, will be sent out following tonight's event. So no worries if you know someone that is registered and did not make it on, or if they missed the beginning, we will have a full recording that goes out. Looks like we are slowing down with those that are joining us. So I'm going to begin with introducing Dr. Melissa Heinen and Dr. Hayley Teich and Dr. Lisa Whitehead. They will be presenting all of tonight's information. And Dr. Heinen, I will let you take it away.
Hi, good evening, everyone. Welcome. As Kelly said, I'm going to share my screen here. We'll be going through the talk and going through some of the slides, and we'll each have an opportunity to go through everything. Unfortunately, there's an issue here about sharing something about the administration host. Kelly, can you help me out there? I have a little technical issue.
I will help you out. One moment.
All right, it says I don't have permission to share.
Interesting. How about we just...
Oh, just kidding. I found it. I figured it out. Just kidding. We got it.
Okay. I have you back up.
Now? Can you guys see the screen now?
We can.
Okay. And it's full slide screen, right?
It is not.
Now we're good?
Yes.
Okay.
Wonderful.
All right. Sorry about that technical difficulty. Hi, everyone. My name is Melissa Heinen. I'm one of the pediatricians at IHA Pediatrics, and I'm also the division head of pediatrics at IHA. Thank you for joining us today. I know there's going to be lots of different questions, and hopefully we've tried to take all of the questions that our parents ask us every day and put them into these slides. So we'll go through all the material and then answer any questions we didn't get to in the end. I want to really start off by introducing my fellow participants here. So this is myself, Melissa Heinen. I also have with us Hayley Teich, and Dr. Teich works at our IHA Cherry Hill Village Pediatric Office, and Dr. Lisa Whitehead, who works at our IHA Domino's Farms Pediatric Office. All of us are pediatricians. The three of us have been taking a very active role, I will tell you, in everything COVID throughout this pandemic. Doing a lot of interest in research and a lot working with the state level from everything that's been coming down for kids and including a lot of the vaccine work. All of us are not only pediatricians, but we all happen to be parents as well. So I think this talk is very timely and all about what we would do for the kids we take care of and our own kids as well. Again, this is just some housekeeping stuff. Everyone has been muted, so please ask any questions at the end. We'll try to answer any questions. There'll be a recording of this presentation, and any questions that we don't get to in the chat, we'll make sure to create a whole Q&A section that will even come with some references, if needed, for some of the sources that we've used in this presentation. So I know there was some questions already about documentation and sources of information and different studies, and we can certainly include some of those in the information that we send out as well. So without further ado, where are we now with the COVID-19 pandemic? So just sort of a lay of the land. I think that if you asked any of us in June where we were at versus where we are now with the new rise of the Delta variant, we would have had, unfortunately, a little bit of different picture. So as of September 9th, just most recently last week, we had 5.3 million children have tested positive for COVID since the onset. Over 243 cases were added last week, and this is the second highest number that we've ever had. We do think that it was declining again in the summer. We thought we were in a better place, and unfortunately, it's increased in the past few weeks due to the Delta variant mostly. Since this pandemic began, children have represented 15.5% of cases. And you can see here that, of course, we have different mitigation measures with wearing a mask and keeping social distance. But unfortunately, it's still a little bit increasing as we speak. About 63.5% of the population has at least received one dose of the vaccine. And so we're still really not there with everyone vaccinated enough to establish what we would call herd immunity or preventing COVID against the entire population enough where even those who can't get vaccinated or have chosen not to get vaccinated can all be protected at this point. So, but a lot of questions have come up. Does it really affect children? Does COVID affect everyone the same? And I think that one of the things that we have to mention is that there is a lot of racial differences with this virus. And we don't necessarily see that with every virus. So this was an interesting racial divide that we've seen just in COVID alone, and how it's disproportionately affecting some of our African American population. In addition, children can be really at risk for some serious illness and long-term health issues. They can be the source of some of the outbreaks that we've seen, and they're still continuing to be at risk for variants that are more contagious and are worse even for some younger people. So really, I just wanted to touch on a little bit on how the vaccines work. And we are on this talk are specifically focusing on the mRNA COVID vaccines. The reason we're focusing particularly on the mRNA vaccines is because currently for 18 and under children, actually 12 to 18 at this point as of today, only Pfizer has been approved, and that is one of the mRNA vaccines. So that's what we're going to focus on talking about today. And if you asked me at the beginning of this pandemic if we were ever going to have a vaccine, I personally was quite worried. I have a master's in public health and follow vaccines for several years now, way before the pandemic. And one of the things I'll tell you is we're not very good at making viral vaccines. We have a flu vaccine. It's pretty good, but it's not highly effective sometimes. And now I am really, really happy to report that the mRNA technology that we're now using is actually much better than we've seen with some of the other viral vaccines. And actually, because of the way the technology works, it actually has less of a side effect profile than we see with other virus vaccines, like, for example, the flu vaccine. And the main reason why that is because the messenger RNA vaccine it's not the same as DNA. It can't combine with our genetic code, and it doesn't use another virus as the vector. And so it doesn't have the same side effects as another virus vector. It only actually transports a protein message and then gets disintegrated within 72 hours. So it is harmless genetic material that creates just a protein. You create it and start to mount this response and antibodies that say, hey, maybe I can recognize this virus. And then your body begins to learn that by using these little spiked little proteins. And then the next time you come in contact with COVID, it will react. That's the basic premise of how vaccines work. But the messenger RNA does it in a way that it just delivers just the blueprint, just the protein message, and doesn't take any other viruses or integration with DNA. That's actually one of the main reasons we don't think it has very many long-term side effects as well. So a lot of people ask us all the time, what are the ingredients in the vaccine? We know it has mRNA, but besides that, what else is in it? Are there preservatives? Are there other things that we are going to worry about? And actually, this is one of the cleanest vaccines that I've also seen, which is also why I think it's a very good vaccine. Simply put, it has some fat, some salt, electrolytes, and sugar. So the fat particle is really interesting because this fatty layer protects that little protein I was talking about, because your body can chew it up very quickly within 2 days. So when you have it protected in this fat layer, then your body can leave it in there long enough just to mount the response, and then it starts to break down. The fat layer is made up of polyethylene glycol, which is a famous lipid because it's also what's in Miralax, And that's something, if your child has ever had constipation, that you've all heard of before. And something that gets readily broken down in your body and doesn't cause any long-term side effects either. So there is no preservatives, and it's egg-free, and there's no other ingredients in there that are weird or peculiar at all. At this point, I'm going to go ahead and pass on the slides to Lisa Whitehead. Dr. Whitehead?
I was just getting ready to respond to one of our questions here. So I answered one of the questions about what type of vaccines the Moderna and the Johnson & Johnson vaccines were. So you should be able to see that answer. Okay, so speaking of how many kids have been vaccinated, right? Obviously, if you're wanting to consider vaccinating your child, which maybe many of you are, you want to know how many people have done this before you. And the answer is many. 8.9 million US kids have already gotten a COVID-19 vaccine. So this has definitely been something that a lot of people have experienced already. What types of side effects did they have? The answer is similar to what adults have. So the side effect profile for the common side effects is the same for 12 and up as it is for 18 and up. Injection site reactions like pain, redness, swelling, or itching are very common. Most people who get the vaccine do get one of those types of reaction, but other more systemic reactions are not as common. You can see a lot of people talk about getting fever with the mRNA vaccine, but actually, especially with the Pfizer vaccine, that is not particularly common. The second dose does cause fever a little bit more commonly than the first dose, but still only about a quarter of people get fever with the second dose. Are you driving the slides, Melissa? There you go. Thank you. Effectiveness of COVID vaccine. So if you're thinking about getting a COVID vaccine, you want to know, does it work? And of course, in the original studies, we heard that COVID vaccines were highly effective. We heard 94, 95% effectiveness. And then the Delta variant came along and people got more concerned with the so-called breakthrough infections, wondering, is this still working? And the answer is it's still working quite well. We can talk about various measures for how to decide if it's working. We can talk about protection from infection, protection from hospitalization, and protection from death. And in all of those cases, the vaccines are still highly effective, even in COVID predominant months. So, for example, protection from infection, the overall vaccine effectiveness at protection against infection was 80% during the time period of December 2020 to August 2021. But it was 91% before Delta and 66% after Delta, reflecting some of these breakthrough infections that we've seen. However, hospitalization rates are still much, much lower in people who've been vaccinated. The Pfizer vaccine is 88% effective in prevention of hospitalization, including the months of July into August. And also during Delta predominant weeks, you can see in this graphic, risk of hospitalization was reduced by 10 times, and risk of death from COVID was reduced by 11 times in vaccinated versus unvaccinated adults. So you would want to know, well, is this helping kids? Actually, adults and teens getting vaccinated is even helping unvaccinated children who aren't yet old enough. Because we know that in states with low vaccination rates, there are much higher hospitalization rates for pediatric age kids getting COVID than in states that have very high vaccination rates. In fact, it's 4 times greater in states with low vaccination rates versus high vaccination rates. So good job for everybody who's already gotten their COVID vaccine. Anyone who's 12 and up, if you haven't gotten it yet, you can protect your kids and all of the rest of the kids out there by getting vaccinated while we're waiting for the younger kids to be approved. In terms of COVID and kids, right? A lot of people say, well, COVID's not that serious for kids. Why would I need to vaccinate my child? Would I want to put them at risk for doing something medically if the illness that we're preventing is not that serious? I would say that it would have been a good idea to vaccinate kids against COVID even before the Delta variant, but the Delta variant has definitely changed the game. We know that the Delta variant is much more transmissible than the original strain and often results in a much higher viral load compared to other variants. And that has played out as an increase in the number of pediatric cases, emergency department visits, and hospitalizations since the Delta variant became predominant in July. We don't actually think the Delta variant is necessarily a lot more severe. We think that it's just a lot more contagious and actually, therefore, is ending up infecting kids a lot more often. So this just puts it in perspective, similar data, but in graph form. So the first graph shows you the COVID cases in 0 to 17-year-olds, August 2020 to August 2021. And you can see when Delta becomes predominant right around July of 2021, that the cases in all of the pediatric age groups, 0 to 4, 5 to 11, and 12 to 17, all went up sharply. And unfortunately, we are still waiting to see kind of where that rise will end. Similarly, with COVID-related hospitalizations in 0 to 17-year-olds in the same age group. So August 20 to August 2021, you see there in July where Delta becomes predominant, and the hospitalization rate from COVID does increase in all of the age groups that are listed there. So although COVID is obviously usually a mild illness for children, it also can sometimes result in more serious illness. I think many of you have heard of MIS-C. MIS-C is a serious illness that affects multiple organs that people can get after having a COVID infection. And as of this month, 4,661 cases have been reported by the CDC. Also, pediatric COVID deaths, while not terribly common, unfortunately, there are children who have died from COVID. As of, again, this month, the CDC reported 159 patients 0 to 4 and 357 patients ages 5 to 18 that have passed away from COVID since the beginning of the pandemic. And of course, long COVID, which happens more often, we think, with adult patients, but has also been reported amongst kids. We know that there are other benefits of prevention of COVID also, other than prevention of the illness itself. In particular, a vaccinated child has fewer quarantines because quarantine guidelines are different for vaccinated versus unvaccinated people. And so they would be more likely to have an uninterrupted education by being able to stay in school, even if they had become a COVID contact. And of course, they would be able to have more social opportunities and less isolation, with therefore better mental health if they were vaccinated.
So we've talked about how COVID is affecting our children, how the vaccine works, how it can help our kids. And now we want to address some specific concerns about safety that we hear in the office a lot. So first of all, what do we know about the COVID vaccine and the effect on puberty, growth, and fertility? So the COVID vaccine does not affect puberty, growth, or fertility. Mainly, we know that because when you think through the way that the vaccine works, we know it doesn't alter cells. So the mRNA never interacts with DNA, your genetic material, and therefore there's no biologic plausibility for how the vaccine could affect these things. After, as Dr. Heinen talked about, as the mRNA vaccine helps your body create this protein, our bodies end up chopping the mRNA up into pieces and getting rid of it within 72 hours. So that's why we don't worry about long-term concerns of the vaccine. There's no evidence that any vaccine, including COVID-19, causes fertility side effects. And that includes, just to enumerate, problems related to becoming pregnant, menstrual disorders that are long-term, erectile performance, or sperm quality. It doesn't affect puberty or a child's reproductive development in any way. It's safe for pregnant women, and that includes through all 3 trimesters. And it is safe for anyone who wants to become pregnant in the future. And in fact, among the millions of people who are now immunized, there were women who got the COVID vaccine while pregnant and women who became pregnant after getting the COVID vaccine. And doctors have been watching all of these cases very carefully. And now the American College of Obstetrician and Gynecologists, the American Academy of Pediatricians, and more than 20 other medical organizations all recommend that pregnant women and breastfeeding women get vaccinated. So the key to protecting against reproductive and sexual effects of COVID is to get vaccinated. Melissa, can we advance? Oh, excellent. Allergies, great. My child has allergies. Should I be concerned about, or more concerned about, an allergic reaction with the COVID vaccine? We are asked often about children who have a history of life-threatening reactions to peanuts, tree nuts, special foods, bee stings. Can they safely receive this vaccine? And the answer is yes. Those kinds of allergies are not contraindications to getting this vaccine. Children with these common allergies can safely get this vaccine, and many have. And then also, if you have a family history of an allergic reaction, either to any one of those allergens, or a family history to an allergic reaction to a vaccine, that also does not create increased risk for getting this vaccine. There's really only been a very small number of allergic reactions, 2 to 5 people per 1 million to the COVID vaccine that's been reported. So allergic reactions are really rare, and the benefit in protecting people against COVID-19 really outweighs the risk. So what about long-term side effects of the COVID vaccine? And why aren't scientists more concerned about that? So I think this is, a point that gets brought up a lot and is really important to know. So with any vaccine, and we, as pediatricians, we give vaccines all the time. All the side effects that we see in vaccines, they all have occurred within 6 weeks of a dose. So we see any problem, it at least starts within 6 weeks of a dose. So that's why the FDA insisted that each of these vaccines be studied for 2 months after the last dose, knowing that there's not been a serious side effect in the history of vaccine administration that hasn't occurred within 6 weeks of that dose. So while there have been some issues, effects of vaccine in the past, they're always picked up within 6 weeks. And so in the pre-approval studies, where the vaccine had been tested in tens of thousands of people, you could say with confidence that, given that number of people, that we knew at least there wasn't a relatively uncommon side effect that was serious. And now, since the vaccine has been given to, more than 10 million people, we can say there doesn't appear to be a rare serious side effect of something that would cause any long-term problems. So we feel really confident about the risk of any long-term side effects with this vaccine. Okay, so my teen has already had COVID. Do they still need the vaccine? So distinguishing between natural immunity and when your body makes its own antibodies, so after you've been infected, versus the vaccine related immunity is important. So natural immunity, we think, lasts about 3 months. It's against the strain that you contracted. And vaccine immunity, we now know, lasts, at least 8 months. And importantly, the vaccine actually induces a polyclonal antibody response, meaning that it gives protection against hospitalization for all the known COVID variants. And so it protects you against more than just the one strain that you contracted. In fact, there was just a study that recently came out that we were just talking about earlier today that showed that if you, looked at people who had contracted COVID and had natural immunity versus people who had been vaccinated, the people who had natural immunity were more than twice as likely to become reinfected compared to the people who had vaccine-induced immunity. So yes, the answer is yes. If your teen has already had COVID, please vaccinate them, because you will protect them from hospitalization in the future. So in terms of whether or not they have to wait after they have COVID, no, they don't. There's no waiting period. And as soon as they're out of quarantine, we really think they should be vaccinated, because there might be another strain coming, and the vaccine will protect them. Okay. Is the vaccine too new? This is something we're asked commonly as well. And I love this graphic because it explains that the creation of the vaccine really was accelerated, not rushed. So there are many reasons why we were able to get to the point of administering this vaccine as quickly as we were. The first was that we got lucky. Essentially, the coronavirus 19 was a virus similar to viruses that we'd already heavily researched. So mRNA vaccines had been studied for more than 10 years in coronaviruses, including severe acute respiratory syndrome, Cova, which was an outbreak that started in China in 2003, and the Middle East respiratory syndrome, Cova, which was an outbreak that started in Saudi Arabia and South Korea in 2012. So we had done a lot of research on mRNA vaccines that we could then apply when coronavirus 19 came along. So that's the new part, that we could use mRNA vaccine technology and focus it on SARS-CoV-2, which is the virus that causes COVID-19 illness. We also happened to have access to a lot of money and resources, which scientists don't typically have. So, because of the worldwide pandemic, I think there were a lot of resources and funding that were available that wouldn't have otherwise, or aren't usually. The vaccine production started before the clinical trials ended. Clinical trial phases were overlapped so that we could avoid downtime. And this is the key, I think, typically it's not easy to find a lot of people volunteering for a new vaccine. And we had thousands of people volunteering in the US to participate in US trials immediately. So, basically it was easy to complete all of the normal steps, or easier, I shouldn't say easy, easier to complete all of the normal steps that we take in creating a vaccine. And because of that, we could accelerate the process. So now that you know that the vaccine, we don't feel that the creation of the vaccine was rushed, is there any other reason to wait? So as of July of 2021, the Pfizer COVID vaccine has been given to over 185 million people. With most vaccines, we have to wait years for a vaccine to be given to that number of people. So at this point, we feel confident in its safety and its efficacy. We feel confident that any complications from COVID are worse than complications from the vaccine. And if you're wondering if you should wait, waiting just puts you at higher risk for an actual infection. So the answer is no, please do not wait. We feel really confident in this vaccine. And the last safety question that we're asked a lot that we wanted to address is the risk of myocarditis after the vaccine. So myocarditis is inflammation of the heart muscle, and it's an extremely rare side effect. Only a small number of people could be affected after vaccination. And the reason we worded it that way is because male adolescents and young adults are the population who are at highest risk for developing myocarditis. And that population, the highest number of people affected is 0.004%. So outside of that population, the risk of myocarditis is even lower than that. So as I said, most of these individuals were males who developed chest pain 2 to 3 days after the second dose of the mRNA vaccine. The vast majority of these individuals had a quick and full recovery with, anti-inflammatory medication like ibuprofen, which is Advil or Motrin. And the Journal of Pediatrics recently characterized myocarditis among boys after vaccination as mild with quick clinical recovery. So, there is a small risk of myocarditis, but the benefits of the mRNA vaccine far outweigh the risks in all age groups from 12 and up. And if you look over at the graphic, this graphic I think summarizes it nicely. Basically, it talks about for every 1 million second dose vaccines given to adolescents, how many cases, hospitalizations, ICU admissions, and deaths are prevented versus how many myocarditis cases there are. And it separates it by gender, given that there's a disparity there in risk. We just wanted to point this out too, that the general population can get myocarditis after multiple viral illnesses. And there's a 16 times higher risk of getting myocarditis after having COVID compared to other viruses. So the vaccine does protect you against the risk of heart problems with COVID disease, where myocarditis can be far more significant in the setting of COVID.
Great, thanks, Dr. Teich. Thanks, Hayley. So my next topic is about the booster shots. And there's some debate whether you're supposed to call them the booster shot or is it just a third dose of COVID vaccine. At this time, it is a third dose for those that need that extra amount in immunity. At this point, it's only approved for those that are immunocompromised. So if you have children that are 12 to 17 that have any kind of weakened immune system, you can certainly contact us. And we are giving booster shots even at IHA for some of those immunocompromised kids. Now, for the general population, are we going to need a booster shot, or even are we going to need shots every year is another question that we also get. That is still ongoing research to be told about how effective long-term the vaccine will still mount the immunity. And we are not sure yet. So I think they're going to, we're seeing data that they're going to come out that probably for those who are 65 and up and possibly healthcare workers, that they might offer booster shots. But for the general population at this point, it seems to be protecting against hospitalizations enough. And so it may be sometime in the future, but at this point, they're going to wait and see how it evolves over time. The reason you need it if you have a lower immune system is to make sure that your first two mounted enough of a response, because they are seeing that in some of the data that maybe if you have a lower immune system, that the booster shot does help those people, that population. If I skip giving my child the COVID vaccine, can I give them some other treatment? There's treatments for COVID, right? And one of the most popular treatments that we hear this question all the time lately is, especially is ivermectin. And so I really wanted to address this as well. And we've all talked about this, Dr. Teich, Dr. Whitehead and I, because unfortunately we've had quite a few patients, pediatric patients where parents have tried to give their children this, and we've seen some ill side effects, and it's very concerning to us. COVID is a virus, and there's no magic bullet to cure COVID, okay, or treatment. Ivermectin is actually a prescription medication approved for parasites. And the doses that people are using for COVID is much, much higher. The only way to get it a lot of times is getting it from animal farms or animal formulations at the feed store, because they do use it for horses. It's considered a horse medicine over the counter. And people are using it at very high doses. And unfortunately, in some of these kids, they're getting hospitalized for vomiting, diarrhea, low blood pressure in like a shock-like state. And they can even have neurological side effects where they have decreased consciousness, confusion, hallucinations. We've seen some have reported seizures, coma, and even death, unfortunately. If you do have someone that you know that is using ivermectin, I would encourage them to stop using it. especially in kids. And I would encourage them to call poison control for medical advice so they can address to you the dosing and if you need to seek emergent medical care or not. In addition, monoclonal antibody is another treatment that we keep hearing about. Is this the magic bullet for COVID as well? I will tell you that the monoclonal antibody treatment is definitely promising as an adjunct helping you if you have COVID, but it is not a cure and it's not a prevention. The only prevention we have for COVID is the vaccine. So a monoclonal antibody therapy is in emergency use for those who have really a high risk condition. And for those who have a high risk condition, like they're very overweight, they have an immunocompromising condition, they have a really complicated medical respiratory condition where they have a tracheostomy or they're on a ventilator, or they have other neurological, congenital heart disease, or some other severe underlying chronic condition. Now, the data is not emerged yet whether this is good for everybody that has COVID. It's an IV preparation that's given in the hospital setting. So if you have COVID and you have some of these complications, we are sending patients that are 12 years and up for this therapy, but they would be admitted through the ER and then the hospital and then getting this IV therapy to try to help mount more of an antibody response. The best way to get an antibody response is to get the vaccine and prevent this whole process from happening in the first place. So another question we get all the time is, what about the masks? So we just wanted to make this one point, because if my child is vaccinated, why do I still have to wear a mask? And we just want to make the point that you can still, the CDC is urging everyone in this high and substantial transmission areas to still wear the mask. And the reason why is, we thought, again, in June, we were going to be good. We were going to not have masks in school, and we were going to be in a lot better place, and more people would get vaccinated. And unfortunately, when the transmission rate is very, very high, nothing was 100%, not even the COVID vaccine. So this is just the best way to protect us against those few that will slip through. And so in a high transmission area. So this is why we still would recommend masks, even if fully vaccinated. If the numbers come down and we're in a better place, then, it's something we can definitely reconsider at the time. So I really want the vaccine for my younger child. Everyone's talking about the 12 and up. When can I get available for 12? So this is news hot off the press. And we were very, very excited that this came on Monday, right before our talk today, that the Pfizer has released that they have data that says that their vaccine is safe and effective for children 5 to 11. The FDA and the CDC will need to sign off on this still. So this is still pending. They tried 3 different doses for the younger kid population, and they found that it was very highly effective, even at the lowest dose of the 10 micrograms. So I'm really excited that they had a study with so many volunteers. And in fact, even though it was a low number of study volunteers, they still did not see any doses of myocarditis in their study. So we think we will see some myocarditis when we vaccinate more and more people, but we think it will be a lower incidence that we were even seeing in the 12 to 17-year-olds because of the lower dose of the COVID vaccine that will be given to this population. As far as even the younger kids, even under 5 years old, those studies are yet to be concluded, but they are ongoing now. And I know actually a lot of physicians where they have kids in these studies up to even 6 months old. And it's been really, really promising and very little side effects as well. So I think the data is coming fast, and we're hopeful that even by Halloween time, they're telling us that the 5 to 11-year-olds will be vaccinated. So how do I get a vaccine for my child when it is ready? If you haven't already gotten your COVID vaccine, we here at IHA Pediatrics are happy to give you your COVID vaccine. We have them in every single pediatric office that we have, and you can see all of our offices listed there. Anyone at this time 12 and up can receive the vaccine. If your child is immunocompromised, we're also happy to do that as well, and talk to your pediatrician, and we can make sure that everyone gets a vaccine. We will have the vaccine for when it is authorized completely for 5 to 11-year-olds. And so give us some time. We are short staffed, just like the rest of the country and everything. So we're doing the best we can to take care of everyone how we can. And we'll make sure we get everyone taken care of, but we will have the vaccine in our offices, and we'll make sure you get the proper dosing and the proper discussion and care for all the vaccines. You can go to our website or call our offices. The other thing I just wanted to touch on too, the three of us, Dr. Whitehead, Dr. Teich, and I, again, we're pediatricians, but we're also parents first. The way that we practice medicine, the way that we practice pediatrics, the way that we've always done it is we would never do anything for ourselves that we wouldn't do for our own children. And we're actually all parents. I think Hayley has her own story and Lisa has her own story as well. My story is sitting here on the screen. Those two boys that you see there on the screen are my 15 and 12-year-old who were first in line, one of the first people in line in my office to get their children vaccinated. Not because I just want to be a poster child for the vaccine or that we're getting any money certainly for this or anything else. It's because I lay my head on the pillow knowing I did the best I could with the data I have in front of me to protect my kids against a virus that's putting kids in the hospital, frankly. It's also protecting my brand new nephew that my older children are around, and also my elderly parents who I want to make sure that if my kids can hang out and spend time with them. So here you see quite a few of our pediatricians as well as our own kids. Hayley and Lisa, more comments on that?
Yeah, thanks for all of what you said. And yes, we are just really thrilled to be able to vaccinate our kids like you were able to vaccinate yours. I have 3 kids, the ages 5, 9, and 11, and they are going to be as close to first in line as possible as soon as the vaccine is available in their age group. So we're very eager to get vaccinated. I was personally vaccinated with the Pfizer vaccine in December and then in January as soon as I was eligible. So we're eager to have them jump on board as well.
And I will echo what Dr. Whitehead said. I actually have 3 children as well. And my youngest is 3 months old. I just recently returned to work from maternity leave, and I was also one of the first people in line to get the vaccine when I was 13 weeks pregnant. So I was actually a member of a number of these studies done on pregnant people who were vaccinated. And I was so relieved to be vaccinated, knowing that I was able to protect my family, including my, at that point, unborn daughter, and now she's here, and we are all healthy and happy that, I was able to be vaccinated. And as soon as my other 2 young children can be vaccinated as well, they will be.
Great, thank you.
Okay, so we do have quite a few questions that have been popping up in the Q&A. If we want to go ahead and work through those. The first question, where can we find data about the studies and potential side effects? And what are the concerns for 5-year-olds in particular as Pfizer submits for EUA in 5 to 11-year-olds?
Lisa, you want to take that one? I'll kind of dictate.
Sure, no problem.
Mhm.
So the data has not yet been peer reviewed and will be looked at with a fine tooth comb by the FDA. So far, Pfizer has said that the vaccine is safe and effective without severe side effects. No cases of myocarditis were seen in the studies that were done. Although, eventually the FDA is going to be pouring through all that data and making sure that they believe what Pfizer said. Once that happens, then we'll have even more additional information. But at this point, for your 5-year-old, like for my 5-year-old, I would go with the safety and efficacy assessment, but pending FDA, we definitely want to know what they have to say.
Great, thank you. Next question. I just got vaccinated today with the first dose. How long before I start producing antibodies? What are the chances of passing antibodies to my 1-month-old through breastfeeding? And if antibodies are passed through breastfeeding, how protected is he and for how long?
Hayley, do you want that one?
Sure. So we know that you start producing antibodies within 2 weeks of the first dose, although you produce the most antibodies after the second dose, 2 weeks after the second dose. So we just produce more and more antibodies, with peaking after the second dose. So as far as whether or not they're passed through the breast milk, they absolutely are. And that's one of the reasons why we really heavily recommend that women who are breastfeeding do get vaccinated, because we can protect our babies with antibodies that we're producing. The studies on how protected are babies and for how long, those studies, the data is a little bit less clear on. So we know that from studies on previous vaccines and antibodies that while you're continuing to breastfeed, you're continuing to give passive immunity to your child and definitely decrease the risk of them getting COVID. But how decreased, we're not entirely sure. So my advice to my patients is that it's certainly better than nothing, and especially since children under 1 are one of the high risk groups of individuals for contracting COVID.
Okay. Next question. Do you anticipate an opportunity going forward for kids 12 and over to receive a lower vaccine dose? For example, 10 micrograms as opposed to 30?
I'll answer this one. So actually, some of the studies were done at different doses in the beginning of some of the vaccine studies. And it wasn't lasting long enough in some of the older kids, because the reason you can give a lower dose of vaccine to the younger kids is because their immunity is a lot stronger. So that's usually what we see with actually a lot of different vaccines. And so at this time, we don't anticipate that, but only time will tell to see how long the actual immunity lasts. But the immunity is better younger, so that's why they can do that.
Next question. Are kids getting sick from the vaccine? Any long-term concerns that you would worry you as a parent versus being a doctor?
Sure, Dr. Whitehead?
Sure. So as a parent versus a doctor, my perspective on this is the same. I'm extremely eager to vaccinate my kids. I'm not worried about long-term side effects. As Dr. Teich went through, this type of vaccine is not going to show us any side effects past 6 weeks. And in fact, the majority of side effects are going to happen within the first week, and they're going to be mild. I would anticipate maybe my kids could have a little bit of a temperature or a little bit of achiness. Maybe we'll give them a dose of ibuprofen if they have any side effects like that. But I do not fear whatsoever for side effects after the vaccine from their standpoint.
And I can chime in to tell you that my kids who were vaccinated, right, at 12 and 15. So my 12-year-old felt completely fine. He said for like the evening he got vaccinated, even on his second dose, and he had a little bit of a headache. The next day he was totally fine. My 15-year-old definitely looked a little more peaked the day after his second vaccine. He was a little bit pale. He kind of was achy. He felt a little nauseous. He only wanted toast and then really didn't feel like that. And then by 4 o'clock in the afternoon, it was a really warm day. He said, I'm going out to play wiffle ball in the neighborhood. And so it was short-lived, about 12 hours, but that beginning part of 12 hours, he did need some Motrin and a little Gatorade that I gave him, and he was feeling much better after that. So I think I would anticipate that for the little kids as well, maybe needing a little bit of TLC.
Thank you. Will we need to get COVID vaccine every year like we do with flu?
So that's a great question that I just don't think all three of us don't really know for sure. That's what I would tell you. We think that we're going to have to see how long the immunity lasts for the booster doses. And if the vaccine changes with a lot of different variants, that might be a consideration. At this time, it's not considered yearly, but only time will tell to see how much we have to change it. If enough people get vaccinated, the virus won't keep changing. That's what I'll tell you, right? And so hopefully enough people get vaccinated where the virus doesn't keep changing every year like the flu. But it does change less than the flu, we think, based on based on how it's been acting so far. So hopefully not, but we're not for sure yet.
Is there a higher risk getting myocarditis if your child has a heart murmur?
I can take that one. So we don't believe so. No, the majority of children who have heart murmurs have benign heart murmurs. And so presuming that that's the type of heart murmur that we're talking about, that it's a heart murmur and that there's no other underlying cardiac condition, then no, you would not have increased risk of developing myocarditis. And then if you're talking about a heart murmur in conjunction with, an underlying heart condition, then it kind of, it depends on the condition. And I would talk to your cardiologist if you're followed by a cardiologist. But the vast majority of heart murmurs in children are nothing that you should worry about.
And are there any health conditions in kids that you'd recommend not getting the vaccine?
So I could take that if you guys would like. If you have an allergic reaction, a severe allergic reaction in the past to one of the components of the vaccine, then you should not get the vaccine. That's obviously very, very rare given the components of the vaccine. People who have had anaphylaxis or another severe allergic reaction to an injectable medication or other vaccine should discuss that with their doctor to make sure that it's safe. It's not an absolute contraindication, but it could be a precaution. In general, though, everybody is eligible for this vaccine otherwise, as long as you're old enough. If you did have any specific concerns with regards to your own health, ask your doctor, make sure that they think that the vaccine is a good choice for you. But chances are it's an excellent choice. In fact, people who have health conditions often are at greater risk for COVID, and it's even more important for them to get vaccinated.
Kelly, I'd like to take this question. This is my favorite question. I get this one all the time. My kids and teens believe that they read everything online. They're convinced the vaccine will make them sick and that COVID won't be that bad. How do I weed out all the false information and the facts online? The doctors online, are they real doctors with information? And how do we even know what's real? So I just have to address this one before we run out of any time, because I think this is huge. And, I think that social media is an interesting tool these days, right? For all of our kids, my teenagers included. What I would encourage your teen to do is actually come and sit with one of us IHA pediatricians, even just make a Zoom appointment, we're happy to do that virtually. I think showing us what things they're seeing online. My child's friends have sent me 1 million TikTok videos that we've actually had great conversations about to know what's real and what's not. I've encouraged teens to use Google. When you see a doctor saying something that you're not sure or that's different than what I'm saying as their pediatrician, Google that doctor. See if they're actually seeing COVID patients. Are they working currently? Are they seeing patients? Quite a few of the doctors I've seen, when you Google them, they have a donation button on the front of their website, on their page. That's not a doctor that might or not be seeing patients, right? So I would encourage your kids to come in and talk to us and have a Zoom appointment and bring us things that they actually can ask questions. And any of us pediatricians are happy to have those conversations and talk about exactly what they are seeing online and on social media. It's actually kind of interesting to us, and we're happy to talk about that at any time.
Thank you. Getting your child vaccinated will obviously help with COVID symptoms in kids. However, if your child still gets it and is asymptomatic, does the vaccine help prevent against long-term COVID side effects?
Dr. Whitehead?
That's a great question. I think that it's unclear what type of long-term side effects somebody who had an asymptomatic COVID infection might have, because by definition, they were asymptomatic. But there is a lot that we don't know about what COVID infection might do for people's bodies in the long term. And absolutely protecting against that, that viral illness, whether it's asymptomatic or symptomatic, would presumably help protect you against any long-term side effects.
I think this information would be beneficial to a lot of parents in our school district. Would you travel to speak at schools?
Sure. We actually, the three physicians you see here couldn't be more involved in your schools and all the care that they are trying to give in the last 2 years. So we are happy to do that. If you'd like to set that up, just contact us.
Are there information on when COVID vaccines may be available for kids under 5?
Dr. Dyke?
Yeah, so there's some information. Yeah, we have some kind of projected ideas. So, as Dr. Heinen was saying before, we are hopeful, if all goes well, that 5 and up will be greenlit before Halloween. And then we are seeing that we think the data will be in on both 6 months and up and 2 and up by the end of the year. So, then that requires approval. And so we're hoping that towards early 2022 would be when we would be able to start vaccinating under 5-year-olds.
Okay. Out of respect for time, we'll take a few more questions and then we'll wrap up. Just a reminder, if your question did not get answered, we will be able to send out question and answers along with the video and presentation following tonight's video. So we'll go ahead and read just a few more. What should we do to protect young kids under age 2, kids too young to wear masks? There doesn't seem to be any information specific to this age group.
Well, I can take this one, and I would say the best thing to do is vaccinate everyone around them, right? We know that not everyone can be vaccinated. Maybe they have a side effect, maybe they're in the process of getting some kind of chemotherapy and the vaccine won't be effective for them, or maybe they're just babies or under 2 and can't wear a mask or get vaccinated. I think their best defense is if you vaccinate everyone around them and keep them away from people that are actually actively sick. That's probably the best way to protect them at this time.
I think this might be a repeat. What is a likely dosing schedule for 5 to 12-year-old vaccines when available?
Yeah, that's the 10 micrograms that we talked about.
The same time frame in between the 2 doses.
Yes.
Yeah. And that's related to the question in the chat too about why is there the jump in the dosing? It seems like a big jump for 11 versus 12-year-olds. And I would say the most important thing is, does it work, right? So it's been tested in that age group and it's clear that it works. It's, a little bit of an arbitrary cutoff. So probably there's a variety of dosing ranges that would work in those kids that are right around that cutoff. But if the vaccine's been tested at a certain dose in 11, we know it works, and then a different dose in 12, and we know that works, then it's reasonable to go with the tested and true approach in terms of dosing. Similar thing is true with the DTaP versus the Tdap vaccines. So there's a cutoff for an age where you would give a DTaP and then another age in which you give a Tdap. They have different doses, but we don't worry too much about whether somebody was of 1 year more or less when they're getting DTaP versus Tdap. I would think about it a similar way.
Right. The vaccine age cutoffs for before puberty and sort of after puberty has been tried and true for years and years and years of vaccine research. So the COVID vaccine is following suit with what we know about development and immunity in kids in that age group.
Do you have any reservations about our obtaining shots for our younger children through local pharmacies, CVS, Walmart, etc., or is the preferred channel through an IHA office?
Yeah, so this is a question I actually get a lot. I mean, I would actually probably, of course, say the IHA office. I know for sure that we're keeping the vaccine at the right temperature. We're making sure that our fridges are right, and we know how to deal with kids. Our MAs give vaccines every day for kids at all different ages. We know how to deal with kids of special needs and autistic kids or any kids that, just need a little bit of TLC when giving vaccines. So I think for those reasons alone, we hopefully would give a little bit more of a comfortable setting. Although I think in the pandemic, There's a shortage of maybe vaccine supply, appointments, ease of parents working, or staffing issues. So I think that it's perfectly acceptable to get it where you can if you feel comfortable with, who's administering it at the time.
Okay, and we'll take one last question for the evening. Is it safe to get the flu vaccine and the COVID vaccine at the same time? Should I get my kids vaccinated for the flu before the COVID vaccine becomes available for 5 to 12-year-olds?
Yeah, I'll just answer this one too. This is a great question. In the beginning of when we started giving the vaccine, there was a little bit of delay in saying if we could give it together with other vaccines at the same time. Now, for the last 6 months, we've been doing that as the CDC has recommended and with very little side effect. So we do think it is okay to give the COVID vaccine and the flu vaccine at the same time at this time. And we've been giving it like that for several months now without any more increase in side effects across the whole country, actually.
Can we answer one more question, an easy one, about should you get your kid vaccinated if they've had COVID already? We just had a question that please get your child vaccinated. Vaccination is more protective against getting COVID the next time than prior COVID infection. And so if any of you have had COVID and aren't vaccinated, go out and get vaccinated if you're 12 and up.
Thank you. And Dr. Teich, Dr. Heinen, Dr. Whitehead, thank you so much. Just want to share a couple messages of things. Incredibly helpful. Thank you. Excited to share this info with some of my hesitant family members. Take care. Thank you for giving your time and expertise. Sure thankful for all of your guidance. And just a few other messages of thanks and appreciation. So I do appreciate your time. Our community appreciates your time. And just a reminder to everyone who's logged in, we will be sending out this presentation along with tonight's video. There will be a post presentation survey coming out, and we will provide you with some FAQs if your question was not answered. So everybody have a wonderful night.
Thank you, everybody.
Thank you.
Thank you.